Good afternoon and welcome to Digimed TV. My name's David Wortley. I'm the CEO and founder of Digimed TV. And the topic for this afternoon's broadcast is nature or nurture, using genomics for personalised health. I want to use this as an opportunity to share my own use of genomics for my own personalised health, and introduce you to a couple of what I think are important players who can offer solutions for the use of genomics to be able to personalize your own health management. So my story begins about 8 years ago, and it began initially with a number of my friends remarking on how fat I was. I was in a stage play in the Little Theatre in Leicester, and one of my friends after the performance said, "Where did you get your stomach padding from?" And I wasn't wearing any. Other friends of mine said, "I'm worried about you, Dave, because you're getting fat." And because I'd never had really any serious health issues in my life, I've only ever been really in hospital twice in my life. Once because I got a spark in my eye from a steam train, and the second time was because I had appendicitis that led to peritonitis. So I had to go in for an operation at a hospital in Birmingham. But that was when I was in my late teens. And since then, I haven't had to go into hospital for anything. So there was really no motivation for me to change my habits. What changed all this were a couple of things, really. My first was an encounter with an Australian academic friend of mine, met in Covent Garden in London, and she remarked to me that she thought I had some Russian blood in me. Because I was a little bit overweight and had a very thick neck at the time, she thought I might have some Russian blood. She suggested that I sent off a sample to a company called 23andme.com to have my DNA analysed, primarily to see whether my genetic origins had any traces of Russia in them. As it turned out, I'm almost 99% certain to be entirely European. And one half of my family comes from an area which is now under the North Sea. Many years ago, it was land called Doggerland. And my other half of the family comes from the Basque region. So this was interesting, but it really didn't trigger me to do anything to change my health, except that when I got the results back from 23andme.com, they alerted me to the fact that I had a greater likelihood of getting diabetes 2. I think it's 50% more chance of me getting diabetes 2 than the general population, purely based on my DNA. And then what finally triggered me to do something about it was an article on the BBC website, I think it was a Click website, that was talking about wearable devices and how they could help to measure your physical activity. And of course, in those days, this was all focused around doing 10,000 steps a day and using a device to track your physical activity. So I went out and purchased one of these devices. It was a Jawbone Up, and on this Jawbone Up, it gave me details about how many steps I took in the day, but also it advised me on the amount of sleep that I had, the quality of sleep, and also I could track my diet. So that was my starting point. And because at the time, I'd been the founding director of the Serious Games Institute and been involved in serious games and gamification for quite a while, I decided that it was time for me to do something about my health, to see if I could use the data from this wearable device to improve the quality of my health. So I started out by looking at my watch, trying to do the 10,000 steps a day, and also recording what I ate, and monitoring the amount of calories that I burned against the amount of calories that I took in. And within 3 months of starting this, going back to 2013, so it's 8 years ago, I had lost 21 kilos. And looked a lot better and felt a lot better. And since that time, I've almost virtually every day, 99.9% of the time probably, I walk at least 10,000 steps a day, which is approximately 5 miles. And I've continued to do that. And over that period of time, I've tried out a number of different devices. It started off with a jawbone up, and then a device called Buddy Band, a device made by Withings, and now I have a Fitbit, which I'm wearing on my wrist at the moment. And all of these devices and all of these applications give you some indication of how many steps you take, how much sleep you get and the quality of that sleep. And also, if you take the trouble to record what you eat, they will give you an indication of how many calories you burn and very often the nutritional value of your food. So I started on this journey 8 years ago. I had some great success. And it taught me a great deal about gamification and healthcare. So my starting point was an obese, overweight man with a high blood pressure at the time, and a high body mass index. And although I didn't feel bad, I noticed over those 3 months how much not only my physical health, but also my mental health and well-being had changed during that time, and how motivated I was to continue this. Now, at the time, and this is quite important for looking at the impact of nature and nurture, at the time I was living on my own. And so it was very easy for me to regulate my daily routine once I got into the habit of going for a walk every morning, almost as soon as I got up. I was able to choose what food I wanted to eat. And so consequently, it was relatively easy for me to lose that amount of weight and afterwards to keep it off. But I also discovered in this process that the importance of the nutritional value of food in the diet. Because what I hadn't realized whilst I was choosing what I ate, I was mainly focusing on keeping off the carbohydrates and eating fairly healthy food with a lot of beans and peanuts and chicken and the rest of it, but I wasn't really ingesting enough protein. And the net result of that was that although I lost all of this weight, my muscles became flabby, even though I was walking 5 miles a day. And I finished up when I was doing exercises on holiday, giving myself a little bit of a hernia in the groin. And so this led me then also to realize that 10,000 steps is not the only thing you need to think about. You also need to think about diet, not only from a calorific point of view, but also from a nutritional point of view. So following the story on, after about 3 years of been doing this and being very careful with my exercise and my diet, I finished up meeting my partner in 2014, and we came to live with each other here in the UK, where I'm living now. And because of that, and because both of us enjoy our food. We enjoy a glass of wine occasionally. It became clear that even though I continued on this regime of 10,000 steps a day, my weight started to creep up again. My face became a bit more bloated. I developed a stomach. And although I still had good mental health, zest for life, lots of energy, my vital signs also suffered. My blood pressure went up and my body mass index and the normal things that you use to measure the quality of your health, they all deteriorated without really me feeling bad enough to do anything about it. And then coronavirus came along. And with coronavirus, it became fairly quickly obvious that those people who were obese and had problems related to obesity were much more vulnerable from serious illness as a result of COVID-19. And so consequently, and I'm going back probably about a year ago, I started to seriously look at managing my personal health again. So continuing on the 10,000 steps a day, but also regulating my diet, not to any major extent, except that I don't eat as much as I was eating. I find that I don't drink any alcohol except on social occasions, which may be only very occasionally, once every 3 weeks or so, have a glass or two of wine. And I make sure that I'm hydrated. So if anyone asks me what the secret to keeping your weight down and improving your health, I would say to them that although the exercise and walking 10,000 steps or regular exercise during the day are important, the most critical thing is your diet and the nutrition. You'll be able to keep good mental health and you'll be able to be physically fit through the exercise, but you will not gain the most health benefits without regulating your diet. So that then led me to realize that there is this combination of health which is based on what you're born with your DNA and your genetics, and what you do to your body as you go through life. And if you look after your body early in life and you get into good habits early in life, you have a good chance of greater longevity, and not only greater longevity, the avoidance of some of the problems that older people suffer. So coming back to today, I'm now investigating different solutions relating to how you use genetics or genomics to analyze your genetic makeup and to be able to translate that into advice on exercise and diet that is personalized to you. So in my case, my DNA from 23andme.com indicated that I had a likelihood of getting diabetes 2. I was pre-diabetic, but I was able to avoid the consequences of that through exercise and diet. So, but 23andme.com only told me that I was at risk of getting diabetes 2. It didn't tell me what I needed to do about it, what kind of exercise I should be doing, or even advice on diet and supplements that were personalized to me. So that brings us today and the topic of nature or nurture, or a combination of the two. So on last week's Digimed TV, I had a guest called Wes Pooley join me on the program, and he talked about his company. He's a performance director of a company called Mudo, which is MUHDO. And they have made a business out of analyzing your genetic makeup and enhancing this with something called epigenetics, which is how you take that basic DNA and you use it to measure how your body rates against your physical age. So in other words, if you look after your body, you might well have a body which biologically is younger than your physical age. Or if you're not doing the right things with your life, you might have a biological age which is greater than your physical age, in which case you are risking your longevity and you are also risking the possibility of poor health in older age. So Wes Pooley, Performance Director at Mudo, was my guest last week, and now I'm going to play a clip which gives you, it's a clip from the interview where Wes talks about his background and how he became involved in this whole area.
And thank you very much, David, for letting me join you today on this call. So my name is Wes Pooley. I'm a Performance Director for Mudo Health. My background is I'm an ex-international professional rugby player. I then worked in teaching education, then moved into personal training, the business world behind working in gyms, and then strength conditioning. I was very lucky to work at Brighton and Hove Albion, England women's football, and I've worked in professional and international rugby as well. And then kind of along the way, I wanted to get my own genetics profile done, because when you're playing at a high level, you always want to know more about your body. And I found out that I got to a stickling point where I was still getting soft tissue injuries when I was playing, and I didn't understand why when I had all the medical support I needed. So I thought there must be some underlying factors there that I didn't know. So I found a company that did DNA profiling over probably 7 years ago now. And at that time, I met the gentleman named James Brown, who had his own company, did my profile, and then kind of worked with James to understand myself in a lot more in detailed terms. And back then it was a quite expensive and long process. He worked with the international teams and Formula One drivers and top rugby teams and individuals. And then I helped support him with getting him into football and some of the other contacts within rugby and other sports that I worked in. From there, because I helped him, we kind of started working together, because I had a performance background and rehab specialism. So I just started helping him with the programming and understanding how to help and support people who probably already had nutritionists and had medical help and had strength conditioning coaches, and we were just there to add value and add some consultancy around the genetic profile and how that would help and support them. We then met another kind of company who were very in the fitness space, in marketing and publishing, and had great routes to market, and basically decided they wanted to personalize health and well-being as best as possible using what we did. So basically we designed a commercial product, which we are now today called Mudo Health, where we're an app-based product that is what we call second generation genetics, really, because first generation genetics is DNA, but what we also offer is what's called epigenetics. So if you're not sure of what the difference is DNA is fixed from the day you're born to the day you die. It gives you a lot of really good information about yourself and a lot of understanding. And then what we do is we provide scientific backed research with actionable interventions with every outcome we have, so that people then understand if they have a predisposition to something, what can they do to make that improvement. So if they have problems with sleep, what could the reasons be with that? If they have problems with their health, what could be the reasons with that? We do not step into the disease diagnostic area, and we do not step into ancestry. We're firmly in the health and well-being space around nutrition, exercise, health, vitamin mineral deficiencies, and then we look at other key areas like sleep, stress, mental health, anti-aging, gut health, heart health, immunity, virus risks, and stuff like that. And the aim is just to help people understand and make recommendations, so they can design an action planner through our app that can be small, simple steps, so they can make those changes and then hopefully turn them into behavioural change and lifestyle habits moving forward. And then what we also do, what makes the second generation, is what we call epigenetics. So epigenetics is measuring the gene expression change over time. So simply is measuring your internal health, and we do that through what's called chronological age against biological age. And the reason we do this is because if you look at some athletes, they may look very, very healthy on the external, and we're happy to say, oh, you look really young, but actually their internal clock is actually not that way. So when I did mine, I was at the age of 35. I was actually 40. I was 5 years older biologically than I was chronologically. And then from my results, I've learned how to understand my body better. So I understood what my vitamin mineral deficiencies were at a genetic level and what I needed to change in my diet, nutrition and supplementation. I found that I didn't process carbohydrates very well, which was causing kind of issues for me within my gut and also within my recovery and my inflammation. And then it allows you to actually measure what you're doing. So the idea is, if you do a DNA kit, the answer is, if you start making those changes, how do you know those changes are actually working? And that's what epigenetics does. And that's why we're different from everyone else, because we offer this service at a commercial and global level. And then you can retest this over time, every 6 months to a year, or if you want to do it more as an athlete, you might do it every 3 months after you've instilled some change and put some actions into place.
So that gives a good overview of the background to Moodoo and Wes Pooley's involvement in Moodoo. So essentially, what started out as a solution for elite athletes to help them to get maximum performance from whatever sport they were involved in, into something more general, which could be applied to anybody. So whereas 23andme.com gave me a genetics analysis with my ancestry and also an indication of my likelihood to develop a number of different medical conditions, including, in my case, diabetes 2, what Moodoo does is to translate your DNA into an action plan, basically, to allow you to improve your own longevity and your own performance. And as Wes took pains to mention, is that it's not a diagnostic package, a medical diagnostics package, in the sense that it will tell you that you've got diabetes or any of the other problems. It doesn't do any of that. What it does is to provide you with guidelines on how, given your DNA, you can improve on your health outcomes through a mixture of exercise and diet. So as our conversation continue, Wes explained a little further.
Of course, it's really simple. It's saliva. So we're basically known now as kind of the new health screening model, because in the health screening world now, you tend to normally have a blood test. The problem is blood tests, they're quite intrusive and they don't necessarily give you everything you need. And then you've got the other medical screening where you might go and get your height and your weight and your body mass done and don't really give you the action points and really specific individual help that you would then need to actually start making change. Whereas we then individualize everything through literally a saliva tube. So the kit's sent to you direct. You do your saliva, you put it back in the prepaid envelope, it goes to lab. Our app then will let you know that we received your sample, and then 2 weeks later you would have your results from your DNA perspective, and then it's another few weeks after that to get your epigenetic results, just because it's a bigger process and takes a little bit longer. And then from the app, from a DNA perspective, as I said in the a little bit earlier, you're looking at the core key areas of things like nutrition, vitamin mineral deficiencies, supplementation, health and exercise. And then also you're looking at the health insights areas, which I was saying were things like sleep, stress, anti-aging, mental health, immunity, gut health, injury prevention, and areas like that. So what it does is it tries to help you understand how your body functions from a genetic level, and then what actions to put into play from that. So within the app, you get an outcome, the genes that we're looking at, the result that we give you, then we give you the recommendations, and we also then give you the references proven by science. That we have 2 science teams that work on our science to then basically say this is where we've got this from, and these are studies that we have actually done personally as well.
So there is some validation behind this methodology. And so what I've done is I have installed the Moodoo app, which anybody can do. You can download that from the App Store, either Google Play or the iOS App Store, and you can install the application. It will only initially give you basically the benchmarks, general benchmarks, and an idea of the information you can get. So what happens is when you install the application, you register yourself and you get sent a little kit. Now this cost me £199, which might sound expensive, but when you consider the benefits of a longer and healthier life, it doesn't really seem so much money. So I received this kit a couple of weeks ago. I put a saliva sample into a little tube that came with the package, and the package also includes everything you need to be able to send that back to the lab. You put that in a post box or take it to your local post office. It then goes to the DNA Centre in Wolverhampton, and from there it goes off by courier to the laboratories where they do the analysis. So now I'm at the stage where I'm expecting any day soon the results of my DNA analysis, and then after that, maybe in 2 or 3 weeks, I will get the epigenetics part of it. And so it's very early days for me to be able to make any judgment on the effectiveness of this, but as Wes Pooley indicated, there is a lot of scientific research that's gone behind this. So Wes continued with our interview.
Yeah, so you look at DNA, so DNA's fixed, and then you think of it like a valve. So basically your epigenetics is if you pour good things in the top of it, and then you have good things coming out the bottom. So negative things like poor sleep, high stress, poor nutrition, no exercise, you get like a negative expression at the bottom. So it's basically how can you use your lifestyle and the environment that you're in to basically manipulate what's called your methylation of your gene to then help you actually slow down or reverse your aging process over time.
So I'm in the process of trying that out, and you can be sure once I've had a chance to try it out, I can come back to you and share my experiences with you. But it does seem to me that we are breaking new ground with this idea of epigenetics, and this combination of your DNA, which is your starting point and which is something you can't do anything about, and epigenetics, which allow you to or give you advice and guidance on the things that you can do to make a difference to your biological age and consequently your longevity and the quality of your life. Now, so if you compare this to the wearable devices and the other medtech devices that are on the market today, so just take for an example the Fitbit that I use and the Apple iWatch, they don't have any knowledge or information about your DNA, but what they will do is allow you to monitor your vital signs, and many of these devices and the mobile applications then allow you to basically track the key things that the medical profession normally track when they are measuring your health. So they'll measure your weight, they'll measure your blood pressure, they might even give you a blood test and create a profile of you, which these wearable devices, Apple iWatch, Fitbit, many other devices, will then allow you to continuously monitor the effect of any changes in your lifetime on these vital signs. But the approach taken by Moodoo, it seems to be more comprehensive. But I should stress that although it's more comprehensive, it avoids giving you medical advice. And I think this is one of the characteristics of Digimed technologies that maybe will change in the future, because there is a danger that if you're using a device like Fitbit or the Apple iWatch or any other wearable device, and you're using that information that comes from that device to give you clinical advice, such as you need to exercise more, you need to do X, Y, Z. And if you do those things and you fall ill or even die as a result, then the manufacturers or developers of these solutions are in line for litigation. Even though research currently shows that the majority of cases where things go wrong are not a result of advice given by technology, more likely to be advice and guidance given by other human beings, because we're now reaching a stage with the developments in technology that we, with artificial intelligence, we can get some more accurate and more sensible advice from the technologies. And I think Moodoo and other companies working in this space are good examples of that. So a little bit more from
obviously
from
our epigenetics, we also ask you questions when we do your samples. We also track through the app all your different trackers that you may use, so sleep, stress, all those different areas. And obviously, if you're making changes to your nutrition or you're trying to be healthier, and say you may be overweight, then obviously if you put these things into play, you're hopefully going to lose weight. Therefore, your BMI, your heart rate, all your other stats will hopefully change as well alongside. So they're the outcome of obviously making those changes to become healthier.
Yeah, so I think you're getting the idea of this, and clearly, or maybe it's not so clear, that Moodoo and similar applications can work alongside devices which measure the parameters like blood pressure, oxygen saturation of your blood, body mass index, and all of these things. They can work alongside of that. So you can see the results of your taking the advice that applications like Moodoo give you or not. But it gives you something more comprehensive. In a few minutes, I'm going to be talking to Dr. Steve Gardner, who's the CEO and founder of Precision Life. And he's going to be telling us about their use of genomics for drug discovery and personalised health management from a slightly different perspective. But I will also be asking him about diet. So just a final piece from Wes Pooley before I go into a little presentation.
We're mainly looking at your age as your indicator, because we're, as we say, our aim is longevity. So how can we help you, slow down or reverse the aging process over time? So that's our key indicator, and all the other bits just play into that main indicator. We have got a lot more modes opening up by the end of this year within epigenetics to give more information around that. And I'm sure everyone's aware that obviously it takes time just to build the research and make sure that what you're showing is understandable to everyone.
So I was very grateful to Wes for giving us that insight, and he sent his apologies that he was not able to join me live today in today's program. So before we move on to Steve Gardner, I just want to run through a little bit of a slide presentation to explain a little bit more about the journey and the need for personal health management. So today's session is on nature or nurture, using genomics for personalised health. And so the background to all of this, and which is why I got involved, is that we have some serious consequences as a result of our modern health lifestyles. And Sir Simon Stevens, going back quite a few years now, he was the head of the NHS at the time. He just recently retired from that. He said obesity is like a slow motion car crash that could cripple the NHS, and it's a bigger threat than smoking. And you can see some of the facts of overweight populations, particularly in different parts of the world, particularly in Southeast Asia, where they do have a serious obesity problem. So, what are the reasons behind obesity, diabetes, cancer, and cardiovascular problems? Well, these relate to our lifestyles. We tend to live more sedentary lifestyles. We, as a result of these lifestyles, tend to eat more convenience food, and on occasions, and I'm guilty of this as anybody, comfort eat as a way of coping with some of the stresses and challenges, particularly of coronavirus. Most people don't get enough exercise, and because it's very tempting to sit in front of the television, and particularly in lockdown, there's little else to do, you develop the couch potato syndrome. But the other thing which is relevant is that we live in a spectator society. In other words, we look on life and expect somebody else to do something about the problems. So we are, as consumers, empowered in the choices of life, and a lot of our daily wants and needs are satisfied. But the key thing is that human beings need physical and mental challenges to lifelong development and maintenance of health. And our lives are evolving into situations where we are not getting these physical and mental challenges at the right level. In some cases, the level of mental challenge is too high, which is where we suffer from stress and burnout. And in some cases, the physical challenges are either too great, which is unusual, or more likely that they're not enough physical challenges in your life. So we're moving towards the aging society where, as we get older, we've got a cognitive and physical decline. And the picture that you see there is of my mother when she was in Kettering General Hospital after being taken there, and it was a serious situation. She had dementia, and she was not expected to live long. And she's typical of a lot of older people who go into care. And all of this really is aggregated by the fact there's a declining working population. And although we're living longer, the quality of our life in older age is likely to include greater illness. This can often be exacerbated by older people finding themselves on the scrap heap from the middle age. And the family care that we used to get, and I think we're starting to go back to, is now being provided in care homes. And all of this results in increased cost of elderly care. Well, now I'm delighted to welcome Steve Gardner in the studio. So I'm going to add Steve to the stream and say, hi, Steve. Thank you very much for joining me this afternoon. I know you've got a bit of a pressure of time today, so I'm grateful that you were able to take the time to join us. I've been talking about Moodoo and their epigenetics and their approach to combining DNA with other technologies and analytics. So maybe I'm going to ask you just to explain about Precision Life and what kind of services you offer and what your kind of vision and motivation is.
Yeah, thank you, David, and thanks for inviting me to explain a little bit of this. So, I mean, just firstly, we're particularly interested in a lot of those diseases that affect patients in their middle and later years, particularly those chronic diseases which are somewhat more difficult to get a handle on. I was around 20 years ago when when we were doing the Human Genome Project, and there was a great promise that that understanding the genetics of individuals and patient populations was going to lead to a big series of innovations in what we would now call precision or personalized or genomic medicine. And that has worked in rare diseases. It's worked in oncology. It's transformed the treatment of some of those disease areas. But it's not worked so well in the dementias, the metabolic diseases, the neuropsychiatric and cardiovascular diseases, autoimmune diseases that plague old age. And a lot of that is down to the disease biology and how complex, relatively speaking, those diseases are, with multiple influences. And that's really what we set out to do. We realized very early on that there was no paucity or no prospect of any paucity in the availability of patient data. But where we were limited was in our ability to understand how the various different impacts on disease come together, and how they affect different patient subpopulations. And I introduced that deliberately because, rather, as you can see from the graphs behind me, which are stratifications of different diseases, the causes of disease in one patient with Alzheimer's, for example, are very much different from the causes of another patient of the same disease in another patient who may share the same diagnosis, but whose disease etiology and therefore their risk, the severity of their disease, the therapy responses that they have may actually be quite different. And a lot of that is down to the way in which these diseases tend to work. They tend to be driven by multiple features coming together. There may be different genetic variants, there may be epigenetic signaling, there may be transcriptomic differences, there may be environmental and epidemiological differences, different comorbidities, different prescriptions. So a whole range of different factors. They come together, and when they come together, they tend to affect the disease phenotype in very unpredictable ways. And therein lies the challenge, because the way that we do our analysis at the moment is very much one feature at a time. We try and understand in a very reductionist fashion what impact a single SNP has or a single gene has. And of course, it isn't that simple. Disease doesn't work that way. It works on, it is a summation of all of the different features put together. And they work, as I say, in unpredictable, or if I'm being mathematically more precise, a nonlinear fashion. And so you have to be able to see those combinations of features at a high order in order to be able to identify epistatic and other type of impacts on disease. And that's really where we come from, is this combinatorial understanding of what's actually driving disease, and trying to get to a point where we can disentangle, as you see behind me, the various different patient subgroups and the things that are relevant to causing their particular disease. Because only if you can do that can you address the unmet medical needs that we see within the patient population. And only if you can do that can you really get to truly personalized digital health type of tools, which are going to be, useful as non-therapeutic interventions for patients. Figuring out what type of lifestyle and dietary changes are actually going to have the biggest impact for them personally. And I think, as I'm sure you've already said, the gamification and personalization of the advice that you provide to patients is by far and away the most effective thing at getting them to actually change their behavior in a way that's going to positively impact their health.
Yeah, so I guess one of the challenges is to to translate this combinatorial approach to genetics into the specific advice for an individual patient. In much the same way that the challenge would be to use this information to prescribe the right kind of drugs. So looking at the pictures behind you, can you just explain a little bit about the what the colours mean on the pictures, what they're intended to communicate?
Yeah, well, we have two behind me. This one is schizophrenia. Sorry, I was a little bit confused for a second there. Schizophrenia and Alzheimer's. And what they're essentially showing you is for individual patient subgroups, which are the different colors, you have the big clusters here. What are the features that are most associated with the disease within that subgroup of patients? And some of those, you're absolutely right. Many of those are genetic because it's relatively easy to get hold of genetic data, but they could also be clinical, or epidemiological, or environmental, or digital biomarkers. So it's really just a way of stratifying that patient population into groups where you can delineate the fact that they are different from one another. Then you can go in and say, well, what are the features that are most associated with this particular group? And we use that when we're doing drug discovery to identify novel targets. But you can also bring in other data. So, one of the data sets that we're involved in it comes from a large-scale clinical trial of 22,000 middle to elderly patient population, and it's all about diet and lifestyle and the impact, measuring the impact that they have on cognitive and metabolic diseases. And so now you can start to correlate this, not with a therapeutic intervention, but with a lifestyle intervention. Saying perhaps one of the specific aims of this project is to look at the effect of cocoflavanols on cognitive and metabolic health in elderly populations. And it may be that for particular patient subgroups, those types of interventions work particularly well. And therefore, that's the advice that you should be giving to them. For others, it may be something completely different. For others, it may even be a drug. And that's fine, but you have to get to that level of advice in order so it's not a one-size-fits-all type of application. Hi, David, you still there?
I can see that's something of a real challenge. So yeah, I'm still here. I know we've had a little bit of a connection problem. I can see you and hear you.
Okay.
It's just a little bit of a technical glitch. But the audio and the video is being distorted a little bit. I'm not sure what the reason behind that is. I hope that you can still hear me.
I can.
But I wondered if you could just say a little bit about diet, how you can translate the work that you do into personalised dietary advice, and also how that might translate to consumer behaviour in a store, for example, people able to identify what's going to be better for them.
Yeah, I mean, I think this is absolutely critical. It is the single biggest thing that patients can control. And as we get older, we get on more drugs. There's more opportunity for side effects of those drugs, many of which are entirely avoidable. And providing patients with tools that allow them to understand their own personal risks and the things that will work with them is really important. So one of the things that we did, when you do an analysis of these patient populations and you can identify the impacts of disease for that patient, you can help guide the selection of the right therapies. But a patient's always going to have multiple other medications by the time they become elderly. And so what you want to do is to provide tools that analyze any food or any menu or any basket of products that they're buying in a supermarket, goes into the ingredients of those foods and checks them off against all of the drug disease and drug food interactions that you may have identified. And this is basically what we've done. We built out a decision support tool that, in a completely personalized manner, allows us to look at all of those interactions for a patient based on their specific combination of diseases and drugs, and we'll give a sort of traffic light display to them of any drug, any food product, basically saying, look, this is really going to cause you some serious side effects. This might be, something as simple as simvastatin is contraindicated with grapefruit juice. Could be as simple as that. Or it might be something a little bit more subtle. There are combinations of antibiotics, ACE inhibitors, and diuretics that are widely prescribed for cardiovascular patients, but are not well. The combinatorial impact on side effect potential is not well understood and is not monitored well by doctors. And there are foods that exacerbate that risk, and it's a pretty serious risk. You can end up being hypocalcemic and fitting. So it's those kinds of issues that you want to help provide the detailed advice, because health systems don't have enough time to provide individualized dietary advice to patients. So being able to do that on a patient by patient basis with a tool that they hold in their hand on their mobile phone that respects the privacy of their information, so it all happens on devices that they own, fully encrypted, fully under their control. I think that's the future of where these types of precision interventions are going to go.
Yeah, and I guess this also raises some questions for us as a society. I'm not sure if you can you can hear me. I will carry on. Yeah, so this raises problems of patient confidentiality, and my attitude is that it's almost like a social contract between society and the individual, where you say to the individual, if you are willing for us to capture this anonymized data about your personal situation, and you're able to track the nutrition and the exercise and all of these other things, not only will you benefit because you'll be given the right kind of advice to lead a healthier lifestyle, but you'll also benefit the rest of society because you will increase our knowledge about the combinatorial effects of all this.
Yeah, I think there's certainly, this is a much wider topic. I think that it is not necessary in all cases for those data to be collected in centralized locations in order to provide the service to patients. Certainly the tool I was describing, everything happened on the mobile phone, and there was no need for their data ever to be shared beyond their phone. So it can be done. It really is a question of what model you're building. Are you building a model that is designed to help the consumer, or are you building a model that is predicated on making large data collections, either in the public domain for the public good, as you said, or held by tech companies? That's a much wider discussion that sadly I don't have time to get into. But I think there are opportunities, as you say, to have a meaningful social contract where data are shared for the good of everyone. And there are certainly many examples of people participating in those type of trials. I think you do, however, have to be very clear about the ownership and the use of those data.
Yeah, I agree with you. I agree with you entirely. But I think that when patients are in need of clinical interventions, having access to that data and a bit of the background and the history is all about the personalisation. So it's this balance between the good of the individual. I think our primary concern, I think, as you say, should be the interests of the patient and how to provide them with the best possible outcomes. Well, I know you are pressed for time, Steve, so I'm going to let you go now and say thank you once again for being with us today. And I'm sure we'll have further conversations and dialogues around this topic.
No doubt. Great to talk to you again. And thanks very much, David.
Okay, thanks, Steve. Bye-bye.
Cheers. Bye.
Okay, so thank you very much to Steve Gardner there he's a CEO and founder of Precision Life. It just shows you the complexity of the challenges that we face. I'm going to conclude now by finish up my presentation very, very quickly to show you a little bit more about the journey that I took and also some of my thoughts on how we address this. So going back to my mum, she's probably an example of some of the challenges of the ageing society and the impact of cognitive and physical design. And my mother died when she was 86, and she died in a care home. And there were a lot of costs and suffering involved during her journey. So what can we do about it? Well, the consequences of a failure to address these challenges are unthinkable. We're already under an enormous amount of pressure as a result of COVID-19 and the added burden of lifestyle-related conditions is going to be monumental. Now, I talked about serious games and health, but gamification has a way of leveraging consumer technology to address these challenges. So I believe that strategic partnerships between international developers of gamified health solutions that are designed to stimulate cognitive and physical exercise for all ages, not just the elderly, can also not only reduce the cost of healthcare, but help older people to actively contribute to the social and economic development and make use of their life experiences. So there are three ways we could do this, either through clinical solutions, influencing industry partners through public policy interventions, or developing personal health management solutions and practices. So here's some examples of clinical solutions. It's very attractive, with COVID-19. We all want to have a jab to protect us against it. And having a jab or an injection makes life very easy for us because it only involves us in going to have that jab. But other examples would be pills, gastric band surgery, etc. Public policy interventions, you already see these every day of your life. If you go into a garage or supermarket to buy cigarettes, you will see the signs up there to prevent you from being sold them. The same is true of alcohol. So all of the things that are generally bad for us, we are seeing the effects of public policy interventions such as taxes and legislations and mandatory showing of guidelines on nutritional contents. Education is another public policy intervention, showing these horrible pictures on the back of cigarette packets, having applications developed, and creating ecosystems which are designed to make people aware of the dangers. The final one is better personal health management. And there's some examples of screen displays on the kind of technologies that can be used to manage your own health and provide preventative health care. So which is going to be the best solution? Who's going to provide it? Well, I think it's important to recognise that we need to transition from a society which is based on curing illnesses and sicknesses to one that is based on preventing them in the first place. So I like to use the analogy of navigating life's journey. So I'd like you to imagine that your life is like a journey from the cradle to the grave. We know what the starting point is. We know various stopping points along en route, growing up, getting married, having a family, being sick, then getting old. But although we know the start and the finish points, we don't necessarily know how long the journey is going to be and how easy or difficult it's going to be. So that's navigating life's journey, and our body is the vehicle that we use for journey. And I thank Jonathan Trent for his comments on identification of diseases. So presumably these were sent in whilst Steve was on the line, and it also reflects on what Steve was saying about what the data is being used for. Jonathan also made another remark, just to say that he's been focusing, in his own word, on a daily urinalysis as a way of personalising data. So please keep in touch, Jonathan, and we'll see if there are any opportunities to collaborate. So going back to the presentation, if we use the analogy of a body as a vehicle that takes us through life, we can see what's been happening with transport technology and the vehicles we use to take us from A to B. So before we had digital data technologies, cars relied very heavily on what I call knowledge professionals or garage mechanics. And so the cars that we used to drive around in were prone to breaking down and repair, and so consequently, the older the cars got, we had more and more reliance and more cost from garages and mechanics. But today, of course, we've got a lot of tools that allow us to monitor the state of our vehicle, and in some cases they are able to diagnose and correct problems or prevent problems, but the key thing is that they are able to know where we are on the journey and how to get to where we want to go, and they're quite patient because they will continue to advise you if you go off route without getting angry or upset. So lifestyle technologies and the solutions that have been outlined by Steve Gardner and Wes Pooley, I think, are all components that are going towards technologies which help us to transform our own personal health management and allow us to go on a journey similar to one that I took, which took me from the person that you see on the left in 2013 to a person I felt much better and happier with only 3 months later. And so my wearable technologies help me to navigate that journey. Today, in 2021, we are much more sophisticated than we were 8 years ago. So it's an exciting journey that we're going on. And I now want to conclude by thanking those of you who joined us for this session and those of you who may be watching a recording. This is a Digimed TV channel production. I'm grateful to Wes Pooley for his contribution and also to Dr. Steve Gardner. All of this is part of trying to make a difference to people's personal health. And I think preventative healthcare is going to be absolutely key to that. So I'm going to conclude by just sharing a little video clip about Digimed TV before I draw it to a close.
Hi, my name is David Wortley. I'm the CEO and founder of 360 in 360 Digimed TV channel. And I'd like to share with you my vision for Digimed TV. We're living in a world now where coronavirus has really changed enormously the way in which we live. But with that change has come an opportunity to build a better world, a world which is more sustainable in every aspect, whether it's the environment or in particular with health. Coronavirus has highlighted the fact that lifestyle-related conditions are placing a huge burden on our public health services and making them unsustainable. We've managed to control the situation to a large extent through the use of vaccines, but it still raises the problem that many of us are at risk of poor health and at risk of getting the coronavirus because of our lifestyle-related conditions like obesity and diabetes, etc. They make us more likely to get ill, and they make it more likely that when we do get ill, we will die. So one of the main objectives of Digimed TV is to create a platform to share ideas on how we can better manage health through digital technologies.